Okay, it's a Monday. That means it's time to get a check on the top COVID headlines from the weekend. Here is Dr. Isaac Bogoch. Dr. Bogoch, good morning.
How am I going to compete with Nelly? Like, really? What Nelly? I'm some boring doctor. This is just a non-starter.
I just said to our crew, I don't know if Dr. Bogoch has ever had Nelly for an opener, but here we go. Yeah. Okay, Canada has passed.
Give it a little razzle-dazzle.
Okay. Well, let's start with some numbers, Dr. Bogoch, because Canada passing a significant milestone, 5 million vaccine doses over the weekend now administered, yet less than 2% of those are fully vaccinated. Is that concerning?
I think what we're seeing is the pace of vaccination is clearly picking up. Obviously, that's a good thing. Do we need to pick it up further? Yes, of course we do. We need to get needles in arms faster, but we are watching the numbers rise. We're watching that slope of people who have at least a first dose of a vaccine go up faster and faster. Stay tuned because, last week there were more vaccinations than the week before. This week there'll be more vaccinations than the past week. We're really watching these mass vaccine clinics mobilize and the vaccine programs mobilize across the country. So things are going to get better. But of course, it's going to take some time and we really need to put it into fifth gear.
All right. We all like seeing your fist pump. My mom gets her vaccine today. My dad is Thursday. There we go. I will do it for you. Ontario and Quebec reporting that many vaccine appointments are going unfilled. Toronto's mayor pleading with those over 70 to get their shot. Do we know what the problem is?
Yeah, I think what we're seeing is some of the growing pains with opening up mass vaccine sites and opening up the booking sites. Like, there's no shortage of people that are clamoring to get a vaccine. I mean, there is an insatiable demand in Canada. So I think a lot of these are unfortunate logistical errors when you're starting to open up these programs. We also saw the opposite. So, for example, in Peel, they had a mass vaccine site that opened up that sadly had people lined up for blocks and blocks and blocks, and they just couldn't process people fast enough. And I think these are unfortunate problems that can be ironed out relatively quickly so we can have a much smoother vaccine process in these centers.
All right, up next, the UK. They are studying, this is really interesting, the safety of mixing different shots of the vaccines. For example, Moderna for your first shot and maybe Pfizer for your second. What could this mean for recipients and what could this mean for vaccination rollouts in general? Could it help accelerate things maybe?
Yeah, I really think this is an interesting study, and I'm looking forward to hearing the results of it. But yeah, they're giving people, vaccine dose A for the first one and a different vaccine for their second dose, and looking at the safety and the efficacy of this plan. Now, this would be helpful for two reasons. One is, we're obviously in a very challenging time and supply chains are occasionally disrupted, or we've heard about different companies not being able to manufacture vaccines fast enough. So if there was a supply chain disruption, we had data to say, it's totally okay to get your second dose with a different vaccine company. I mean, I think that could help us here in Canada. The other thing that's interesting is there's theoretical benefit of having a more robust immune response to the vaccines. If you get a dose of one and then a second dose of a different brand of a vaccine. Again, let's wait for that study to come out. Currently, we're not doing that in Canada, but of course, if the data says that this is a good idea or that it's possible, we can always pivot.
Now that Canada has an adequate supply of PPE, some are suggesting that we start using N95s more regularly. Should we consider upgrading our face masks?
Well, I mean, the Public Health Agency of Canada, I thought, had pretty good advice on this. And basically, there's three big things. One is put on a mask. Obviously, we need to do that in indoor environments. The second thing is make sure the mask is snug and make sure it's snug over the mouth and the nose, right? We're not doing the chin mask or the neck mask or anything like that. You've got to have a snug fit. And the third thing is to wear a high-quality mask. And the high-quality mask, of course, can mean different things to different people. But if you go on the Public Health Agency of Canada website, it actually gives some pretty good recommendations about 3-layered masks and the type of material that can be used. I still think that's adequate. N95 masks are fantastic, but I think the data shows, based on where we're at now, that we should be using those really in some healthcare settings. I don't really think that the utility of those in the general public would be as significant or as great. But again, if there's good data suggesting that we should pivot to N95s, obviously I'd be open-minded. I just haven't seen that to date. So I still think we've got to focus on getting people with masks and getting people with high-quality masks in indoor settings and wearing them right. But N95s for non-healthcare settings, I don't think many of us are there yet.
Okay, vitamin D, Dr. Bogoch, it does a lot for us, including keeping our immune systems healthy. And a number of studies are now looking at it possibly lowering the risk of us getting COVID. What do we know when it comes to vitamin D?
Yeah, so a few points on this. One is that in Canada, there are a lot of good reasons to take vitamin D. Forget COVID-19. We really need to supplement with vitamin D, or many of us need to supplement with vitamin D, especially in the wintertime in Canada. And if you have any questions about this, this is a great idea to speak with your healthcare provider. When we talk about specifically with vitamin D and COVID-19, the clinical studies are, let's just say, weak at best. There's a lot of correlation, but not a lot of causation. And there's a lot of big claims saying that vitamin D can do this and vitamin D can do that. To date, we actually haven't heard very strong evidence for vitamin D protecting people from COVID or reducing the risk of COVID with robust clinical studies. And when you see observational studies, there might be a signal and an arrow pointing in that direction, but then when it's studied in more detail, we just don't see that same association. That's not to say we shouldn't be taking vitamin D. There's many of us that should be taking vitamin D, especially in Canada. But unfortunately, with the relationship with COVID just hasn't really worked out. And obviously, it would be wonderful to have a positive effect. We just haven't really seen that yet when the detailed high caliber studies are conducted.
All right. Thanks as always, Dr. Bogoch. By the way, I just heard in my ear that Nelly is in our virtual green room. He's been watching, and he cannot believe he's got to follow Dr. Isaac Bogoch. So there you go. Thanks again, Doctor. Good to see you.
See ya. Have a good one.